Hey, it's Dr. Angelina Pastoff with Georgia Surgicare Arts and Ideal Body Institute. I am a triple board certified surgeon, and I'm here today to talk about cosmetic breast surgery. Let's start with how do you choose your surgeon. It will depend on exactly what you're looking for, of course. You have to usually do consultations with a couple of surgeons, unless you have your own preferred surgeon that you always go to. Depends on your area and your preferences. So in a similar area, in a similar, let's say, state, let's take Atlanta and suburbs of Atlanta, different doctors will have different pricing. I get a lot of patients who prefer a female cosmetic surgeon. So of course I get a lot of referrals made to me because of that. So you have to look at your comfort level and see who you prefer to have as your surgeon. Would you prefer a female surgeon or male surgeon? You want to look at the work of the doctor to make sure that that's what you're all about. The type of breast surgery we see. So breast implants, obviously very common. People who don't have enough breast tissue genetically, that's how we were made. Want to get a little bit more volume in the breast, that's very common for breast augmentation. Patients who had breastfeeding their kids and now the volume was lost, we sometimes need to fill it up, and so breast implant is a great option for that. Next will be mastopexy or breast lift. That procedure can be done with or without implants, and there are of course a couple different types of implants, silicone and saline. We'll get into it in a minute. And then breast reductions are also common. So again, depends where you are on that spectrum. There are different variations for the patients. Another very common procedure is mastopexy, but also with the reduction of one side. So very common for women to have different size breasts. So it could be as much as 1 or 2 cups difference, sometimes more, in the breast size naturally. Are implants safe, or which implants are safer? So the two most common implants that we use now are silicone and saline. They are smooth, so this is an example of silicone implant here. It's a smooth texture, so it's nice and round. And the second option will be saline, basically the same thing like this, except it comes empty, and during surgery I would fill it up with saline. Both of them are safe. The implants that were not safe years ago, they were taken off the market and no longer available. Obviously, we still see patients who had those implants back in 1990 something, and we often see those patients to remove the old implants that were most likely ruptured and place new implants in. These implants are basically like gummy bear implants. That's silicone. Meaning if they rupture, if I have a cut here and I squeeze it, it will go right back in. It will not leak all over the place like your Home Depot silicone. So it will stay in place. It will not go anywhere in the body. It is safe. It feels squishy. It's soft. It can take a lot of pressure. So that's a common question. Are they allowed to be squished? All you want. Saline implants are very similar as far as squishiness, because again, the silicone capsule that will hold the saline together is the same as the silicone capsule that holds silicone implant together. So saline implants are a little bit cheaper. Plenty of studies been done to look for complications, and so far between saline and silicone, they're very similar. How long do implants last? Will they have to be replaced at some time? So the most common number you will hear about implants is replacement every 10 years. Now, they're not tires. They will not have to be replaced every 10 years, absolutely on the dot. Again, you're not driving on them. However, on average, you may have to have a replacement, whether it is something happened that you don't like the look anymore. Maybe you had a baby and now they don't look the same. You want to change the size, get an upgrade. Maybe one of them ruptured. Sometimes it happens. Obviously, we know about those patients where saline or silicone implant ruptures. Again, very rare, but if it happens, of course, we have to replace it. Some people may get capsular contracture, and when we fix that and take out the capsule, we can replace implants. So on average, I think, yes, you might need to do something every 10 years or so, but if you're absolutely happy with your implant at 10 years, you can keep it a little longer. Worst case scenario, if saline implant ruptures at, let's say, 12 years or 15 years, because the risk of rupture increases the older the implant gets, then you replace it. So I don't think it's absolute must to replace it at 10 years, but possibility is definitely there. What is the difference between silicone and saline, and which one do you recommend? I think it's personal preference. I know a lot of surgeons out there really prefer the silicone. I feel like I have great success with salines. So for me, I really leave it up to patient and what they're looking for. So the cost of silicone is a little bit more expensive. Sometimes it is a driving factor for the patient. But again, I have good results with either one. So I really leave it up to patients. What would my scar look like? So in my practice, I have two different options that I do. I either make incision under the nipple, basically inside that areola circle, the little color difference that naturally happens between areola and the breast skin. And I would use that as my preference. In some patients, especially when I do silicone implants, the scar will be underneath the breast. It's very similar in size. For the silicone, it will be about 2 inches in size, about 5 centimeters. For saline, it could be a little bit shorter. We can work through a much smaller opening to put saline implant in. Scar on the breast heal very well. Around the nipple, about a year goes by, you will not see that scar. The one scar underneath the breast, again, it usually heals very well, and obviously well hidden inside your bra or whatever outfit you wear, so it rarely will show. How long does the surgery take? About an hour. If we're doing straightforward breast augmentation, it takes about an hour. If we're doing breast augmentation implants with breast lift, obviously that might take a little longer, and just depends on the size of the breast and how much work we have to do. It will add a little time. So, but 45 minutes to an hour for regular implant, hour and a half to 2 hours for implants with breast lift. Another quick point about breast implants and how do we decide the size? Usually it's a combination of several factors. One, measurements. When you come in for consultation, we'll be measuring you. And based on that, we can help you, guide you on the appropriate size. Number two, what is it that you want? Patients have different expectations and different ideas. Somebody wants to just look just a little bit plumper, just a little bit fuller, very natural. So nobody can really tell the difference. You're doing it for yourself. You just want just that extra touch. Other people say, no, 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 no. I want people to know I got this done. I want to see the little basketball going across here, right? We want that upper pole fullness right here. And when I wear my swimming suit, when I wear my little short dress or whatever, they need to be up here. Let's quickly go over cost of procedure. So for breast implant, the straightforward breast augmentation, that takes about an hour. The fees will be similar like any surgery. There'll be fee for surgeon fee, which includes usually your pre-op and your post-op visits, surgery itself. The implant cost, so depends on type of implant you choose, silicone or saline, there is a fee. Anesthesiologist fee, anesthesia, medication that goes with it, and operating room fee, so facility fee. Depends where the surgery is done, whether it's done in the hospital, whether it's done in an outpatient surgery center, or whether it's done in an office-based surgery center, the fees will be different. I'm sure also depends on your surgeon's training. who is doing your surgery, your fee will be different as well. So for this kind of surgery, I definitely recommend going to sleep. So general anesthesia is the most comfortable and safest in my opinion. So you need to have a facility that is approved for general anesthesia. In my practice, we use JCO accredited surgery center, where we do have an anesthesia provider that will be putting you to sleep, and you'll go home the same day for surgery like this. So again, cost of the surgery includes all of those fees. Usually for saline, around my area, I would say about $4,500, $5,500. Silicone, I would add probably another $1,000. Around $5,000 plus minus based on the type of implant that you choose, I think is a good price for implants in my area. For lift, again, we're adding extra time for surgery, we're adding extra work, extra incisions, so the cost will go up, and I would add at least $1,000 to $2,000 for the lift if you're doing it together with implants. Again, depends how much work, if it's a redo surgery, whether it's previous scar tissue in the breast, those things can increase time in surgery and again influence the cost of the surgery. Breast reductions will be higher because now the work is more involved, it takes a little bit longer time, again depends on the size of the breast that we're starting off with, so that definitely will bump up the price because of the type of work it is.